Having no ultrasounds in pregnancy is certainly a choice, but it's also a choice of a practitioner not to feel very comfortable with that. Compromise sometimes is necessary, although the ultimate decision does belong to the pregnant woman. But there are things that you can do when you do an ultrasound, and you can limit the time that you're exposed to an ultrasound. I can do a 20-week ultrasound and look at the things that are important in probably about 2 minutes. What normally happens in an ultrasound when you go to a radiologist's office or a tech does it is they're scanning away. And so one of the things that you could do is you could theoretically ask them to turn the machine off as much as possible, or just be very, very brief.
There's this great article that I was reading earlier today, too. It's benefits and risks of ultrasound in pregnancy, talking about the risks and benefits. It says, as in the case with most medical procedures, however, its performance carries some risk, misdiagnosis on one hand, possible undesired effects on the other. Most of the development in embryology happens before 10 to 12 weeks. So we try and limit exposure to as many harmful things as possible. And ultrasound is one of them. And so there's not a lot of science that actually supports having one of those early ultrasounds. So if you're feeling comfortable with your dates and your last menstrual period and all of that, and you don't need a dating ultrasound and you don't need to check about the viability of the pregnancy, avoiding that early ultrasound could be a really good option.